Hello， 大家好，欢迎来到洛杉矶华资讯网的直播现场，我是主播莉亚。在现代家庭生活当中，生育压力是一个逃不过的话题。那么，由于不孕不育的发病率上升，高龄生育困难、生育意愿和生育结果没有办法匹配的情况也越来越多见。那很多女性呢，都愿意通过生殖辅助技术 IVF， 俗称试管婴儿来生育后代。那么实际上呢，从2007年到2020年期间，中国的这个不孕不育率的发病率已经从12%升到30%。那每年呢都有30万的这个试管婴儿诞生，而美国的 IVF 市场渗透率也更是高达30%以上。那么由此可见呢，这个技术可以说是被大众普遍接受。那么关键问题来了，试管婴儿什么流程？怎么备孕？大龄的女性该如何准备？那今天呢，我们将会在节目中一次弄懂这些话题。非常荣幸邀请到的就是美国著名的试管婴儿专家 IVF， 同时呢也是 Hrc 圣地亚哥分院的医生 Dr. Koffler。他在生殖医院呢有25年的经验，也是美国生殖医学学会 ASRM 和多个专业医疗组织的成员。他所在的 Hrc 生殖中心更是被美国 Newsweek 新闻周刊评价为美国最佳生育诊所。那么在本期节目当中呢，我们将会邀请 Dr. Koffler 来为我们讲解这个话题。Hello, Dr. Koffler. It's an honor to have you with us today.
Thank you, Leah, for having me. It's a pleasure to be here.
To start off, could you please introduce yourself and share more details about your professional career with our audience?
Certainly. Hello, everyone. I'm Dr. Mickey Koffler, an infertility specialist at Hrc Fertility in San Diego. I have been practicing medicine for over 30 years. My passion is helping couples and individuals build their families. Whether you are a heterosexual or same-sex couple or a single individual, I offer personalized care and a range of treatment options, including male and female infertility, IVF, egg donation, and surrogacy. I'm very proud to say that our success rates are among the highest in the world.
Wow, that's wonderful. We know that preparing for pregnancy, especially through IVF, can be both an exciting and a challenging journey. And there are many factors that women need to consider to enhance their chances of success. And one crucial aspect is maintaining a healthy lifestyle. So could you please detail the recommended diet and the lifestyle adjustments to help women to prepare their body for pregnancy?
Absolutely. Generally, maintaining a normal weight can be very beneficial, and healthy lifestyle is really crucial for optimal fertility. I would recommend a balanced diet rich in whole grains, lean proteins, fruits, and vegetables. Adequate folic acid is particularly important to prevent neural tube defects, and an increase in iron and calcium intake is helpful to support the pregnancy increased blood volume and support bone health. Lifestyle factors such as regular exercise, adequate sleep, and stress management can contribute to overall well-being and can positively impact fertility. It's essential to avoid smoking, excessive alcohol consumption, and avoid exposure to any known environmental toxins, as those may negatively impact your egg quality.
Got it. So maybe some supplements can apply to their diet, like you said, iron or something.
Correct.
Great. That's great advice. Thank you so much. And now, once women have adopted these healthy habits, and what are the next steps in the IVF process? Specifically, what kind of examination do women need to undergo before the embryo transfer, and how far in advance should they start to prepare?
Okay, so specifically before embryo transfer, women typically undergo blood tests to check hormone levels, an ultrasound to assess the uterine lining, a saline sonogram, or even preferably a hysteroscopy to assess and correct any uterine cavity abnormalities that can decrease implantation. Preparation time varies depending on the on factors like the embryo transfer protocol and other personal circumstances. Generally, it can take several weeks to complete the entire process. Now, in cases of previous failures, preparation should begin at least 3, maybe even 6 months in advance to allow time for any necessary treatments or lifestyle adjustments. I make sure that none of these examinations cause any patient discomfort, so no pain. And for hysteroscopies, I always do them under anesthesia.
Got it. So during the embryo transfer, it's okay to feel nervous about it, but you don't have to worry about it too much because you make sure it's a comfort process.
Not painful at all.
Not painful at all. Thank you so much. I think that will release a lot of pressure. Now IVF can be a hope for many people, and for sure, you have seen a lot of success stories. And just like your introduction, you have the highest rate of the success rate. So throughout your career, among these families you have helped with, what is the oldest age of a woman who has successfully used her own eggs? And can you please share her story with us?
Yeah. While success rates decline with age, it's not uncommon for women in their 40s to achieve successful pregnancies with their own eggs. Each case is unique though, and factors like overall health, ovarian reserve, and egg quality play a very significant role. Now, in my personal experience, the oldest patient that conceived with her own eggs was almost 46-year-old at the time of her egg retrieval. But it happened after 7 previous failures. Mm-hmm. She started trying when she was about 43, and she did not want to give up on her dream. Now, I must emphasize, though, that this is very unique, and that particular patient had an unusually high ovarian reserve.
Got it. So after 7 times her failure, and then she still decided to keep going on. So for regular women like me, I'm over 30 years old. How many times should I prepare for average?
Hopefully much less.
Hopefully much less,
ideally,
yes.
Ideally it would be for someone young with a good ovarian reserve. We should be able to help those patients in 1 cycle.
That's great. During these successful stories that you're involved in, I feel like that's really inspiring, and it shows that within the right approach and support, age doesn't have to be a barrier to achieve these dreams of parenthood. So next question, can you please explain how GPT or pre-implantation genetic testing can benefit success rate and ensuring the birth of a normal baby, as well as allowing for gender selection?
PGTA stands for pre-implantation genetic testing for aneuploidy. And it is a genetic screening test that identifies embryos with the correct number of chromosomes. So it can be very helpful as it may increase the chances of a successful pregnancy and also reduce the risk of miscarriage. It also reduces the risk of conceiving a child with a chromosomal abnormality. So it practically eliminates the situation where patients may be facing a dilemma of pregnancy termination for a baby with a chromosomal anomaly. An additional benefit is that it allows you to plan your family, as it provides information regarding the gender of the embryos and offers you the choice of transferring the embryo of your preference.
Got it. I know that you have talked about miscarriage online before, and I feel like there are 7 points that is very insightful. I have a friend actually, she tried 3 times with her own eggs, and each 3 times she got miscarriage. What kind of recommendations or suggestions you probably to give these women to avoid miscarriage?
So it depends if the patient has done pre-implantation genetic testing on the embryos. If she did, then one other option is obviously to do additional testing, because in very rare instances, there may be other factors that can contribute to miscarriages, like immunological factors, hematological factors, infections. So there is more testing that can be done, but generally most miscarriages or at least the known ones, are related to abnormal chromosomes, so chromosomal abnormalities in the embryo. So doing the PGTA is definitely going to reduce the risk of miscarriages. So if your friend maybe did not have PGTA on her embryos, then it's definitely a good reason to do it.
Got it. It's very fascinating, like how advanced the reproductive technology has come. So lastly, do you have any advice for women who are hoping to have a baby?
My advice is to start by optimizing your overall health, maintain a healthy weight, exercise regularly, manage stress, and avoid harmful substances. If you are concerned about fertility, consult with a fertility specialist early on. Don't delay things, because your age is the most important factor affecting your success rate. And remember that every woman's journey is different. Now, with patience, support, and the right medical guidance, many women can achieve their dream of parenthood. Lastly, make sure that you receive your care from a physician that would treat you as if you were his family. Mm-hmm. This is a very emotional process, not just for the patient, but also for the team that is treating you. I treat my patients the way I would like to be treated.
Wow. Thank you so much. And one last question, so just for myself. So for me, I just had a daughter. She was born on April 2nd. And I'm already, yeah, thank you so much. In my early, 30 years old right now, if I'm considering to have the second baby or third baby, should I consider, for the embryos or frozen eggs, etc.? Because I'm just like you said, age is the most important factors. And during like my increasing age, probably I'm gonna have the hard times in my third baby.
So yeah, I'll tell you what I told my daughter, and actually it's actually true. My daughter is 31, she's not in a relationship, and she decided to freeze her eggs. And I was very supportive because, and she's open about it. I'm not telling you any secret that she wouldn't share with you.
Okay.
Like, she shared it on social media. She's very open about it. Yeah. She's a physician. She's a educated girl, and she's not in a relationship that she is ready to commit.
Yeah.
And start a family. So basically, she froze her eggs. Now you are in a relationship, so you don't need necessarily to freeze your eggs. You want to secure. I think the best option is to actually what is called bank embryos. Because you can basically what you can do. You can freeze embryos now. You can test them. You can do PGTA, so that they are chromosomally normal. In order, the gender. If you want boys, girls, like you can, like I said, you can plan your family. And this way, in the future, ideally you should bank at least 2 embryos for every future child that you want, because an embryo is not a baby. An embryo is just an embryo, and when you place an embryo back into the uterus, there is about, let's say, roughly a 60% chance of live birth. Okay. So if an embryo fails, you have a backup. So ideally, you should have about 2 embryos for every future child. I mean 2 normal embryos, two chromosomally normal embryos for every future child that you want, and that can give you some sense of
secure.
That's I would say confidence.
Yeah.
Okay.
Thank you so much.
Correct.
And are there any topics that you wanted to touch in but I didn't ask as a final?
No, thank you so much for having me. It was a pleasure, and I'm looking forward to having future conversations with you.
Thank you so much for sharing your expertise with us and all your patient stories and your family story. Thank you so much. 那么，如果大家感兴趣的话，那在这里给大家讲一下，就是 Dr. Koffler 呢是目前全球来说成功率最高的医生系列之一哈。那如果您对今天的这个话题感兴趣的话，都其实可以拨打中文的咨询电话。拨打电话中文咨询电话是 Linda， 它是206-399-7700。那这是一个中文的咨询电话，或者是扫描屏幕上方的2维码来做更多的中文咨询。那下一期呢有更多 Hrc 生殖中心的医生 生们，会为我们讲解更多有关于试管婴儿冻卵以及甚至代孕的相关的注意事项。那我们下期节目呢将会不见不散。Thank you so much, Dr. Koffler. I'll see you next time.
Thank you for having me. It was a pleasure.
Great. Bye bye.